We are privileged to have opening keynote addresses, then we'll have a presentation panel and some reflections, and then closing remarks. Now, it's my great pleasure to introduce the two keynote speakers. Diéné Keita, Deputy Executive Director of UNFPA and Assistant Secretary General of the United Nations, and Jean Libelle, President of the International Development Research Centre of Canada. Welcome to both of you. Diéné Keita is former Minister of Cooperation and African Integration for the Republic of Guinea, and she has served as the UN at country, regional, and global level, including as a UNFPA representative in many countries and as a UN resident coordinator. She holds numerous postgraduate degrees in economics and development, including a doctorate in law. As president of IDRC, Jean Libelle leads its contributions to Canada's foreign policy and global innovation efforts. IDRC hosts the Center of Excellence on CRVS Systems, which is UNFPA's key partner in the Converge initiative and our co-host for this event. And Mr. Libelle holds a doctorate in environmental sciences. So it's a great pleasure and an honor to all of us that you're with us today. And allow me please to turn this first to Deputy Executive Keita, and the floor is yours, please.
Thank you, dear Rachel. President Jean Libelle, International Development Research Center. Distinguished panelists, partners, colleagues, friends, all protocol observers. Dearest young people, it is a great pleasure to co-host this event on the sidelines of the 54th United Nations Commission on Population and Development. Today, we highlight the importance of inclusive civil registration and vital statistics, CRVS, as a tool to advance gender equality and women's empowerment everywhere. I would like to use this opportunity to extend deep thanks to Canada for its global leadership in championing gender equality and the empowerment of women and girls. We are proud to have Canada as trusted, long-standing, and committed partner. Your leadership towards promoting evidence and data in support of gender equality, sexual and reproductive health and right, and life-saving humanitarian action is much appreciated. And this is the time to thank the International Development Research Center specifically for our joint partnership on the Converge initiative. Civil registration is fundamental to personhood and securing one's legal identity from birth until death. Yet, millions of people are born, married, and die without leaving a trace of their existence in legal records. In many parts of the world, CRVS systems are weak and deficient, constrained by impediments that particularly exclude women and girls. Under registration is particularly high for those who live in locations that are remote to registration facilities, who lacks access to information, written or digital, who lacks the economic means to register a life event, whether in direct fees or time and travel costs. Finally, under registration is high for those who are on the move or living in circumstances disrupted by armed conflict, food insecurity, climate events, and other crises. In a simple word, CRVS is a critical tool for women's empowerment. It underpins their legal standing and that of their children and their ability to claim basic rights. Legal identity is indispensable to leaving no one behind, as it proves place, date of birth, and family lies, affirming a relationship to community and the state, guaranteeing entitlements and the obligation of citizenship. We all know how a birth certificate is critical for a girl to secure her right to education and healthcare. Marriage registration provides women with protection under the family code and can ensure legal right to inheritance. And because a birth registration provides legal documentation of age, it has the potential to protect a girl from child marriage. CRVS systems are also a critical population data source for routine planning for many sectors: housing, schooling, transport, and public services. In 2020, COVID-19 highlighted the fragility of many civil registration systems, and in particular, death registration systems that were overwhelmed, and many governments were unable to report the COVID-19 death by age or sex. Lastly, but not the least, CRVS secures basic rights. Birth, marriage, and divorce registrations offer numerous protections. They inform the design of social protection system and provide data on the common age of vital events for different populations. For instance, the mean age of marriage of first birth, the proportion of adolescent mothers, or the number of older persons. Civil registration can protect a woman's right to custody of her child, to potential inheritance, to land, and to property. But we are far from that promise. We can celebrate progress making women and girls more visible in routine statistics, but we must acknowledge the vast undercoverage that we still need to address. Dear friends and colleagues, gender norms are often reflected in civil registration system. For example, when denying birth registration to children if their mother lacks a formal marriage registration. Can you imagine? UNFPA newest State of the World Population Report 2021 that we launched last week shows the consequence of such gender norms. Only 55% of women make their own decision about whether or not to have sex, to use contraception, or to address their own healthcare. The Converge initiative is an example of UNFPA's continuous efforts to promote inclusive population data system as a means to help women and girls be visible, be counted, and thrive. Today, we will hear from one of our young UNFPA population data fellows working out of the UNFPA Benin Country office I served in myself a few years back, Priska Omujeni. We will hear about the challenge that the Leave No One Behind agenda faces about gender stereotypes, regressive social norms, and misperception in Benin, Republic of Congo, Burkina Faso, and Senegal that hinder the universal registration of all birth, marriages, divorce, and death. We will also hear about important work from Colombia, which links community-based midwives, handle technology, and the National Statistics Office to ensure non-facility birth and death are included in the official vital statistic of the country. It is opportune that we discuss this effort on the sideline of the Commission for Population, as the CRVS system offers a scalable means to advance gender equality and leave no one behind during this decade of action, and to support the aim of the Generation Equality Forum. The future of sustainable development is directly linked to fulfilling the aspiration of women, adolescents, and youth. Empowering women in partnership with and support of men and boys and the world 1.8 billion young people, and unleashing their full potential to contribute to economic and social progress is instrumental to achieve the vision of ICPD Program of Action and the Agenda 2030. Our joint event that we convene here with Canada and the Global Financing Facility around the CRVS and gender agenda is timely, as both have been leaders in linking CRVS capacity to reproductive, maternal, newborn, and adolescent health agenda. Along with UNFPA, Canada and the GFF have made bold commitment within the Action Coalition of the Generation Equality Forum. as UNFPA embarks on its co-leading role with the Action Coalition on Bodily Autonomy and Sexual Reproductive Health and Right, it will leverage population data, including CRVS, to advance the Action Coalition work. Dear colleagues and friends, on behalf of UNFPA, I warmly welcome your engagement with the Converge initiative and invite you to join UNFPA and IDRC in transforming our aspiration for inclusive CRVS system into greater gender equality across the world. I thank you.
Thank you so much, DED Keita, for those inspiring words and for really underscoring why civil registration is so central to the rights of women and girls. This has really framed, I think, this event. Now, please, if I may turn to Jean Libel, we welcome you for your keynote and the floor is yours.
Thank you very much, Rachel. Merci beaucoup, Madame la Directrice Exécutive Adjointe. It has been a pleasure to listen to you. It is an honor to be with you, but I'm quite humble at the face of your remarks and what I'm going to be providing the audience with. So everyone, good day wherever you are, and my signs of appreciation for your availability to attend this session. It is an important session to us and to UNFPA, as we have been a partner in crime, as we say in my country, about making concrete step towards the improvement, implementation, development of civil registration and vital statistics system, not only as system, but as a fundamental and important component of data system to advance women rights and women empowerment. And this morning I was reflecting that the last time I discussed at CRVS, what I was at the Women Deliver Conference in Vancouver a few years ago. And from the note that was prepared by my staff and the member of the Center of Excellence that are excellent, I could already see some of the progress with concrete example that I will use to illustrate the work that you are doing in the field and you are making to improve our journey towards the achievement of sustainable development goals. My organization, the International Development Research Center, takes a special interest in civil registration and vital statistics system because we believe these systems are the bedrock of monitoring the sustainable development goals. And they are fundamental, in our opinion, to reducing gender and social inequalities. I will use our time together to speak to 3 points. I'm a good bureaucrat, never more than 3. My 3 points are first to speak about the importance of partnership and the collaboration we have with UNFPA through the Converge initiative, the Center of Excellence with the Center of Excellence for CRVS system is an excellent demonstration of this. And we are very pleased to host the Center of Excellence. And I want to thank here in particular Global Affairs Canada that has been showing strong support and collaboration, and the Global Facility and all the members around the Center of Excellence. The Connecting Vital Event Registration and Gender Equality Initiative, the Converge initiative, is a remarkable initiative. It has support in 14 countries from Africa, Asia, and Latin America to strengthen gender consideration in their civil registration and vital statistics system, done in part through strengthening the often neglected statistical capacity in countries. The holistic approach, focusing on all life events that Converge adopted, has been important in getting civil registration and vital statistics systems to be understood and financed as a whole and not in piecemeal. It has contributed to our collective understanding of why segments of population are less registered than others and what we can do about it. This is having concrete impact on people's lives. And let me share you one example that was brought to my attention and I really love. Blessing is a woman in Western Kenya who realized that marriage registration was an important safeguard for herself and her daughters. After starting to have children, she convinced her husband to join the small percentage of couples in Africa who have registered their marriage, an issue that the previous speaker highlighted. 4 years after they registered their marriage, Blessing lost her husband in a traffic accident. Her husband's relative tried to claim her land and the family money, but her marriage certificate protected Blessing and her sixth daughter. They were able to keep their land and access the money in her husband's bank account, which she was able to use to pay the school fees for her daughters. This is only a one-person example, but there are hundreds and thousands of cases where this one snapshot that I gave you have shown how registration protects rights and improves life. That brings me to my second point, which is the role of CRVS system to development policymaking and combating inequality. The Center of Excellence and UNFPA, through the Converge Initiative, have been a strong advocate for the importance of marriage registration for women's rights. As a result of our continued joint advocacy, question on marriage registration were added to the world's most widely trusted source of demographic data that you all know, the Demographic and Health Survey, DHS-8, which is being administered in 120 countries in 2021. We will have the first ever comprehensive global picture of marriage registration thanks to the work of Converge and to the DHS-8. CRVS system, therefore, are no longer an abstract mechanism of collecting administrative data, but a rigorous tool to monitor and promote gender equality and to make everyone visible, as Madame the Directrice Executive Adjoint has shown previously. We see this in example around the world. In Morocco, Burkina Faso, Jordan, Congo, Brazzaville, Benin, and Senegal, the Center of Excellence generated evidence around barrier to vital events registration and how this is impacting women and girls. Countries that haven't produced vital statistics in decades are now doing so. For instance, for the first time in 20 years, Morocco produced a vital statistic report with sex disaggregated data, a first step, a small one, nonetheless an important one. That gives you a sense of how widespread and meaningful the impact has been. Besides protecting the person, their spouse, and their descendant through certification of birth, marriage, divorce, and death, including cause of death, civil registration generates important granular vital statistics that are key for policy and decision-making and all issues related to population and development. Without knowing detailed information about the population, where people live, who they are, and what their needs are, it is impossible for government and other agencies to know who is left behind and how to reach them. Women and girls are disproportionately excluded from CRVS data system. Our attention needs to focus there also. The system needs to work equitably for everyone in a trend that we see across most low and middle income countries. For example, in Morocco again, 65% of male deaths were reported in comparison to only 35% of female deaths. An unregistered death makes it impossible for a spouse, more often a woman, to inherit or remarry, as I illustrated before with the Kenyan example. An unregistered death also fails to capture information about the cause of that death and therefore the opportunity is lost to agency and services to take action to improve the health of others by using this information. Just think of the impact of COVID-19 pandemic these days. That brings me to my final point, which is connecting this work to the development framework. Harnessing data to advance women's rights and to empower women is critically important for the development agenda to ensure women, girls, and other marginalized groups are not left behind. It's always a bit frightening to see there's only 9 years left to achieve the ambitious 2030 agenda. The need for better gender responsive CRVS systems only grows day by day. And fortunately, there are people like you that are looking at it. It's essential to monitor progress against the 67 indicators that are directly related to achieving 12 of the 17 SDGs, and only CRVS systems of quality, of rigor can help us to accomplish that. A global pandemic and the growing effect of climate change have exposed and worsened inequality, eroding development gains that were made in the last decades. But through the 3-point I covered, partnership, role of CRVS system to combat inequality, and their connection to this broader development framework, which is the SDG framework, we can overcome inequality. I want to thank you for your attention and for allowing me as a president of IDRC to have, through your work, a better understanding of the intersection of gender and CRVS system and speak about it. And through this, we want to make sure we are overcoming the challenges that makes sure that everyone benefits from whatever progress are made, and that we can speak with data, facts, story, and robustness of our progress. It is my sincere hope that this meeting will do more than just generate ideas. We're very good at this in the science sector. I encourage you to find the pieces that work within your organization mandate, and encourage you to make the commitment that will take you at the end of the meeting to a place where we can say that together with our own specificity, we can advance gender sensitive CRVS system. The goal of leaving no one behind is within our grasp, but it can slip away if not everyone is counted. We have here today a community of like-minded people, committed individuals. I'm excited to see what we can accomplish together. And as an illustration of my excitement, I made a commitment to stick with you, to listen to where you are and what you will be doing. And it will be a pleasure to listen your voice, your expertise, and your concrete suggestion for moving forward. Our journey with UNFPA, it's only in its infancy. I'm looking forward, Madame la Directrice Exécutive Adjointe, à la poursuite de notre travail ensemble in order to make simply the world better through our work and the work of our colleagues. Thank you very much, and back to you, Rachel.
Thank you so much, Mr. Lebel. This is between the two of you, the inspiration I think has been set, and the motivation to listen closely to the work that's already been underway and indeed commit for more work together. Thank you so much for your concrete examples also about Converge and reminding us about the human impact and the woman in her family in Kenya. These examples are so helpful to all of us. I'm going to thank you both now, and I'm going to turn to the panel. Okay, so we have a panel I'd like to introduce. First, a presenter will be Shannon Kowalski, who's the Director of Advocacy and Policy at the International Women's Health Coalition. And she also co-leads the Generation Equality Forum Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights. I'm also going to go ahead and introduce, also we'll have Priska Umajeni, already mentioned as a population data fellow here, who's been working very closely in our country office in Benin. Welcome to Priska. Also now, please, if may I ask to join us, Lady Manuela Mosquera Moreno, who's the executive director of Asora de Par, a community-based association of midwives in Colombia. And Maletela Nwekesa Kasi, senior health specialist at the Global Financing Facility for Reproductive, Maternal, Newborn, Child, and Adolescent Health and Nutrition. Delighted to have you. A warm welcome to all of you. And please, Shannon, to start off the panel. Over to you.
Thank you so much, Rachel. And it's such an honor to be here and to be a part of this discussion today. So I'm here for one reason, as everybody else on this panel is too, to discuss how civil registration and vital statistics are critical tools for increasing gender equality, addressing discrimination and inequalities, and most of all, helping to enhance the bodily autonomy and decision-making power of women and girls at all stages of their lives. It's important because of three very fundamental things. First, it makes women and girls visible. It's the key for individual women and girls to claim their rights and exercise autonomy over their lives. And it allows government, civil society, and others to develop policies and programs that are responsive to the information that we glean from this data. So I don't need to tell you that having a legal identity is powerful. It's the key to recognition of individuals as human beings with inherent rights from the earliest stages of lives. And for girls, this is particularly crucial. It unlocks their access to school, to healthcare, and to other public services. It gives women and girls the ability to claim their human rights, to get a job, to own property, to equal protection under the law, to be able to vote and otherwise participate in public life and politics. And all of this is fundamental for women's and girls' ability to have control over and make decisions over their own bodies and lives. Yet millions of people, particularly those who are already marginalized and excluded, born, live, and die without any legal recognition. And for women and girls in particular, this lack of legal recognition increases their vulnerability to poverty, abuse, and to violence. So let me give you some examples. In Indonesia, for example, there was a groundbreaking household survey of 320,000 people across 17 of the country's 34 provinces. And it uncovered a really clear link between the lack of a birth certificate and early marriage. They found that 90% of girls in child marriages do not have a birth certificate. Our own partner, the Association for the Promotion of the Autonomy and Rights of Girls and Young Women, APAD, which is in Marawa in the extreme north of Cameroon, was founded and is run by the survivors of child marriage. And they work in communities to support child brides, as well as to prevent child marriage. And they have put working with child brides to obtain birth certificates for themselves and their children, as well as marriage certificates, at the top of their priority list of actions, because they have found that it is absolutely critical to unlocking access to financial and healthcare services, to education, and also to increasing their autonomy. It's just one, but a really vital part of their strategy to empower survivors of early and forced marriage, as well as other young women living in Marawa, and helping to support them. And it's part of a multifaceted strategy that also improves their literacy, but also trains them on human rights, gender equality, and sexual and reproductive health issues, and also helps them to speak out against early and forced marriage themselves as survivors. They've described that it's a critical entry point as well for advocacy with leaders in Marawa. It opens up conversations about both the incidence of adolescent births, as well as child marriage in the region, and it really has helped them compel action to address the issue. So that leads me to my next point. The importance of birth certificates and legal identity has been really well established, and many are working towards that. But equally as important is the registration of marriage and divorce, for many of the same reasons. First of all, it's a critical strategy for combating child marriage, and for a number of reasons. It creates transparency around the marriage, and requiring proof of age. Just the need to register a marriage, particularly where there are other laws and policies in place to address it, can be an opportunity for intervention. But with marriage also comes legal rights, protections, and responsibilities, which are really important for both protecting and enhancing women's rights and their empowerment. Legal proof of marriage ensures that they can claim their rights to property and entitlement if their spouse dies, or if the marriage ends with divorce. And registration of divorce, on the other hand, just as important, because if women do not have records of their divorce, that can also prevent them from accessing critical social services as heads of households, claim the right to remarry if they want, or address the distribution of parental responsibilities with their former spouses. Similarly, in Indonesia, in that same household survey I referenced earlier, they found only 24% of divorced women had divorce certificates, which is a significant impediment to their rights. So what are some of the barriers at the individual level to registration for women and girls? So for those who live in rural areas, who have disabilities, who come from ethnic or racial minorities, or who are otherwise marginalized, there are many barriers. It could be the distance to registration centers, the cost of registration or access, the lack of personal autonomy or the need to seek permission from male relatives, for adolescent mothers or unmarried mothers, stigma, and cultural norms, or just plain lack of awareness about the need and importance of registering these key life events can be barriers. And so governments really do need to take action to proactively address these gendered barriers to registration, including by doing things like bringing registration processes closer to communities and linking them with other community-led or driven services, such as, for example, midwives, which I think we'll hear about later. But beyond the individuals, I think it's really important for us to note that the data that's captured through civil registration and vital statistics, as well as other data collected by national statistics offices, helps us to identify some of the critical challenges to gender equality and to respond to them. But there's massive gaps in the data, as others have already referenced today, and it limits our ability to not only understand the experiences of women, men, girls, boys, or where we have it, gender non-binary people, but it also cuts short the possibility of developing services, programs, laws, and policies that support gender equality. And it can also perpetuate discrimination, right? So if, for example, abortion-related mortality, gender-based violence, or adolescent birth rates are not being recorded because we're not collecting that data, then it also limits our ability to address it. Let's take the example of death registration, for example, where the underlying registration of female deaths relative to male deaths can prevent us from identifying causes of death that impact women in particular, and develop evidence-based programs to address them. So we know that intimate partner violence is a critical challenge. Approximately 1 in 3 women worldwide experience violence over the course of their lifetimes. In low and middle income countries, incidence rates can be even higher. We also know that about 38% of homicides of women are committed by intimate partners, compared to 6% of men. But in the majority of countries of the world, including in more developed countries, CRVS data on cause of death is not useful to extract data on deaths that are a consequence of intimate partner violence. And as a result, we don't have an accurate picture of the number of women who are killed at the hands of intimate partners or who experience femicide each year. Finally, I want to emphasize that this is really a matter of human rights. International human rights treaties lay out several human rights that underpin the importance of civil registration and vital statistics. And these rights include the rights of all individuals to have equal protection under the law, the right to birth registration, the right to a nationality, the right to provide consent to marriage, and the rights to equal access to registration and non-discrimination before the law, including on the basis of age, sex, race, refugee status, migrant status, or disability status, among others. So governments have an obligation to not only protect these rights, but to ensure that all people within their borders can exercise them. It's critically important that CRVS systems are designed with protection of human rights and gender equality as key principles that underpin them, not only to fulfill the human rights obligations that states have, but to ensure that they are empowering for women and girls and can be used to address harms. So for example, if women do not themselves have identification documents, it can be a barrier if they need them to register the births of their children. On the other hand, registration of births could be used as an opportunity to ensure that women themselves also have their own documents, and therefore give them a powerful tool to enhance their autonomy and their rights. So we have some key opportunities before us to strengthen CRVS systems so that they support gender equality. The importance of gender data, for example, has already been recognized in the Sustainable Development Goals. And indeed, we cannot measure progress against critical goals, including Goal 5 on gender equality and women's and girls' human rights, and Goal 3 on health, without strong rights-based CRVS systems. But we also have an opportunity before us with the Generation Equality Forums that are being organized by UN Women, the governments of France and Mexico, and feminist civil society, and the 6 action coalitions that they will launch in Paris in July. The action coalitions are exciting to me, in particular because they are multi-stakeholder initiatives that bring together like-minded governments, private sector, private philanthropies, civil society organizations, and others to address intractable barriers to gender equality and to the realization of women's and girls' full human rights. So these action coalitions will address gender-based violence, economic justice and rights, bodily autonomy and sexual and reproductive health and rights, climate justice, technology and innovation, and the need to invest in feminist movements and leadership. So we at IWHC are really pleased to co-lead the Bodily Autonomy and SRHR Action Coalition in partnership with UNFPA and many others. And what has become clear in our discussions is that we will need really strong CRVS data in order to ensure that we're meeting our goals, not just in this action coalition, but across many of the action coalitions, in order to ensure that all women and girls everywhere, in all of their diversity, can claim their human rights and live in a world that is just and equal. So this is really a call to action to make sure that we have the data that we need to develop gender responsive strategies and to use it as the tool that it can be to achieve gender equality and human rights. Thank you.
Thank you so much, Shannon, in particular for bringing everyone's attention to the action coalitions as a next major political event and opportunity for all of us to further these goals. Thank you so much. I'm now going to turn to Priska Umajeni, who's going to give us some field data from her work in the country of Benin. I think we may see some slides. Is that true? Yes, indeed. And I do have to, 2 points, engage with the Q&A. All of our participants, please do so. And I do have to ask the speakers to try to keep your interventions within 10 minutes so that we can make the time work. Thanks so much. Over to you, Priska.
Okay. Thank you very much, Lecho. I would like to share with you some field-based perspective on civil registration, vital statistics, and gender from Converge country engagement in multiple countries, including Benin, the country where I'm posted with UNFPA. Converge takes a life course approach by engaging civil registration from birth, death, including marriage and divorces. The Converge initiative strengthens CRVS system to ensure that there are gender transformation, both in terms of being accessible, sensitive to the challenge of registering civil vital events of women's and girls, and also in ensuring that vital statistics from civil registration data are sex disaggregated and support gender equality and women's initiative across the life course. Phase 1 of Converge initiative, which has been launched back in March 2019, has entailed global engagement to align Converge with data effort around the Around 2030 agenda, ICPD program of action, and the Generation Equality Forums. regional engagement with major CRVS strengthening initiative in Africa, Asia, Latin America, and Arab states. Country engagement in the following priority countries as Benin, Burkina Faso, Republic of Congo, Senegal, Jordan, Morocco, Tunisia, and Laos, Ecuador, Colombia, and Guatemala. Converge initiative is focused on 3 major areas. The first is completeness assessment, which engage the question, who is missing from CRVS system. The second is social norm field research to determine the under-registration factor, which seeks to understand why are they missing. And the last is CRVS data usage, which supports the National Statistics Authority in producing, disseminating, and using vital statistics to support men, women, and girls' light. A key strategy of Converge initiative have been to nurture the next generation of CRVS talent via UNFPA Population Data Fellows Program. The program prays for fellows for 12 to 18 months in UNFPA country office, regional office, and headquarters to engage in direct technical assistance to civil registration authorities, National Statistics Office, and Ministry of Health as well. My own work in UNFPA Benin country office have been focused on supporting a systematic assessment of the CRVS in Benin through a gender lens and contribute to the capacity development of civil registration authority at the municipality level, guiding the National Statistics Office on production of vital statistics from the available civil registration data system assessment. A major focus of our work is to understand who is left out of civil registration system. The graph here shows the registration across geographic region of Ecuador. The blue dotted vertical line shows at the national level that male deaf registration is more complete than female deaf registration, shown by the orange vertical line. However, this masks notable variation in some part of the country. Deaf registration is above 80% completeness, and in others below 30% completeness. And in some part of the country, female deaf are registered as much lower, related to male deaf. For example, in Molona, Santiago, female deaf registration is 20% point lower than male deaf registration. Such statistical analysis, which is a staple of Converge initiative, is critical for 2 practical reasons. The first reason is guiding the national effort to reduce inequality in civil registration system coverage. The second reason is the adjustment of incomplete civil registration when producing representative vital statistics. After establishing how completed birth, marriage, and death registration system is, we focused on understanding why certain people are missing in the systems. Our approach is use social norm field research and draw on focus group discussion and key informant interview with different community members. Here we adopted a conceptual model developed by IDRC that composes the structure determinant of vital event registration at the individual household, family, and society level. The diagram here shows the conceptual model specific to marriage registration determinant. About birth registration and certification, our research shows that women and girls bear substantial responsibility of registering their vital event and registering the vital event of their loved ones, but they are also face a number of social and cultural barriers. In Benin, our field research identified a dominant view among Lulo women and their primary responsibility for the registration of birth of their children. About marriage and certification, when it comes from marriage registration, we had a consensus view amongst men in rural area of Senegal that prioritize the religious ceremony of the wedding over the legal certification of the marriage. In Burkina Faso, the dominant view among other men was that official marriage registration undermines the financial security of the men's families. About death registration and certification, in Morocco, rural women, especially those with low level of education, perceive that they don't have the legitimacy to register the death of their husband, and instead, they must rely on a male relative to do so on their behalf. About the vital statistics, the UN principles and the recommendation on vital statistics system list more than 50 standard vital statistics tabulation and output as a minimum standard in terms of annual vital statistics output of all countries. UNFPA and the IDRC Center of Excellence through Converge have been supporting National Statistics Office in West, Central Africa, Latin and Arab states in producing, disseminating, and using vital statistics to advance effort around gender equality and women's empowerment as well. In the interest of the time, allow me to visually share the main conclusion from Converge phase 1 and pass the floor back to our moderator, Rachel. Thank you.
Thank you so much. This has been really fascinating and I think helps us see the full range of challenges from birth to death. And I think that life course approach is enormously important. Thank you also. The data on Ecuador was particularly notable because it seems that the differential between the sexes is holding at low coverage and it's holding at high coverage. So it seems to be not a function of overall coverage. The sex differential is sticking there. So please, thank you so much for this. I'm now going to turn us to Lady Manuela Mosquera Moreno. I want to remind all that she will be making her presentation in Spanish. So the interpretation button is there, and over to you, Manuela. Dear, you are muted. You are muted. Yeah, okay.
Saludos para todos. Si en algún momento en mi español hay frases que no se comprendan, pues aquí estaré juiciosa escuchando para poder dar aclaraciones. Pero ¿qué quiere hacer Manuela Mosquera? Contarles la experiencia de parteras y parteros en el departamento del Chocó en el marco de un proyecto súper importante denominado Partera Vital, que fue un proyecto desde la Oficina de Estadísticas en Colombia y el USPA. Este proyecto, en el marco de la pandemia, generó muchas acciones o logros que enfatizan o enriquecen la labor que hacen las parteras en el territorio, independiente que en Colombia no las asuma como parte del sistema de salud. Partera Vital contaba con 5 líneas. Quiero hablarles un poco del proyecto con 5 líneas. Estas 5 líneas contaban con incidencia, abogacía en las instituciones, fortalecimiento a las parteras, dotación a las parteras de un equipo con un aplicativo, que era otra de las líneas, que ellas podían reportar los seguimientos y los nacimientos de los niños y las niñas en comunidad. Este proyecto también contó con un acompañamiento o se complementó con la Registraduría Nacional en Colombia, quienes le entregaron a las parteras un formato para certificar o registrar entre parteras e informar a las comunidades, informar a las instituciones de salud sobre los nacimientos de las niñas y los niños en comunidades, y sirve como antecedente para el registro civil. Entonces me parece importante todo lo que han hablado los anteriores panelistas, el mismo proceso. Muchísimas gracias por la invitación y para mí es un orgullo estar aquí contándoles esta experiencia. La pandemia generó muchas problemáticas. Hubo muchos muertos, aumento de casos de morbimortalidad. La pandemia nos dejó ver todas las brechas con las que cuenta Colombia y en el departamento del Chocó el sistema de salud. Carecemos de muchas cosas, pero así como hay riquezas, hay estas carencias, pero hay unos hallazgos que se encontraron en el marco del proyecto, a través de la pandemia, y era que las madres, los papás, pagaban por el registro de nacido vivo para poder registrar a su hijo. La partera atiende el parto y le entrega a la madre el niño, y al registrarlo, la enfermeras y médicos le pedían a esta familia que pagaran para poder hacer el registro de nacido vivo y así poder registrar el niño o poder acceder a los derechos de la maternidad en muchos casos. Fueron hallazgos importantísimos, parteras que no ejercían su labor con libertad por temor a ser denunciadas o por temor a que las estigmatizaran como brujas, hechiceras o que están haciendo algo indebido en el territorio. Pero el proyecto generó muchos logros. Partera Vital, gracias a UNFPA, gracias a la Oficina de Estadísticas en Colombia, a la misma registraduría, permitió, uno, que las parteras se cerraran esas brechas de tecnología. Las parteras cuentan con teléfonos inteligentes, con teléfonos que les permiten a ellas y cuentan con un aplicativo, y este aplicativo facilita la información o el registro, la notificación del nacimiento del niño y la niña. El proyecto, hay algo impactante que generó, y es que nosotras como asociación, como mujeres que ejercemos la labor en comunidad, poder saber dónde estábamos, quiénes somos, qué hacemos, porque atendemos los partos en nuestras comunidades y cómo ayudábamos o hacemos ese acompañamiento a las familias. Otro logro es que hoy día la partera cuenta con un formato de notificación y se registran los niños y las niñas ante las notarías o registradurías sin necesidad del testigo, que será otro hallazgo. Para poder registrar un niño que nace en comunidad, había que llevar un acompañante, 2 acompañantes, lo que llamamos acá 2 testigos, que dieran fe que ese niño había nacido de mano de una partera y que había nacido bien. Y así sucesivamente, los logros son impactantes. El proyecto en sí permitió ese acercamiento de las parteras con la institucionalidad, permitió que las parteras ejercieran con mayor propiedad y empoderamiento ese liderazgo, que ellas no atienden un parto por quererlo atender, sino porque les nace, porque consideran que es una forma de apoyar a nuestras familias en aquellos lugares remotos donde el sistema de salud, si llega, le imposibilitan ejercer la labor, y cuando no llega, quien hace la labor de acompañar a las familias en la etapa de gestación y nacimiento es la partera. Entonces, esto es un proyecto, no me quiero extender mucho, pero es un proyecto que facilitó los registros de los niños y las niñas en la comunidad, facilitó la integración de la partería con las instituciones, facilitó el acercamiento de las parteras con otras parteras del mismo territorio que estando en comunidad no se identificaban ni se conocían. ¿Por qué? Porque en medio de la pandemia, en medio del proyecto, se ejercen o se activan muchos canales para reportar. Entonces, hay un aumento de mortalidad materna, se dice, que después, a raíz de la pandemia, pero nosotras las parteras consideramos que no, sino que ahora se pudo reportar, ahora se tuvo en cuenta la partera como alguien especial, como esa lideresa que está en comunidad, que puede contar qué está haciendo y qué está sucediendo con las maternas en sus territorios. Y así sucesivamente, hay algo que es de resaltar, que recibimos capacitaciones a través del DANE. El DANE para nosotros es, digamos, ese sistema de registro en Colombia. Recibimos capacitación desde la registraduría. El UNFPA hizo acompañamiento, seguimiento, monitoreo a las parteras, y hoy día contamos con un territorio que identifica 1.050 mujeres. Uno dice, wow, hay hombres y hay mujeres afroindígenas que ejercen en el territorio una experiencia muy hermosa de acompañar gestantes, y lo más importante, de notificar y poder registrar con libertad a un niño y una niña que accedan a su derecho del registro civil. Entonces, digamos, son muchas las cosas, pero no quiero extenderme, pero sí quiero contarle. Esto es un proyecto que necesita el apoyo de todos. Yo quedé impactada con las anteriores panelistas, cómo comentan su historia, sus experiencias. Siento que también hay muchas cosas de esto en mi territorio, y quiero invitarlos a todos digamos, apoyar, a ahondar en este proceso. Se requiere una segunda fase. Y cuando yo digo se requiere una segunda fase, es que allá en estos territorios donde, digamos, hablaron las anteriores panelistas, también se puede llevar este proyecto para que las mujeres lideresas en comunidad que atienden parto, que les permiten hacerlo, porque sé que hay muchos países que no permiten la partería tradicional, puedan ellas ejercer esta labor con libertad, acompañar con amor y empoderamiento a la familia, y ante todo poder registrar los niños, porque es su derecho, independiente que no nazca en la institucionalidad, el niño tiene derecho de ser registrado, nazca con quien nazca, porque recuerden la autonomía que tiene la mujer sobre su cuerpo, y es ella quien decide, es su derecho, con quién tengo mi hijo, cuándo tengo mi hijo y en qué momento accedo a las instituciones de salud, y ellas tienen derecho a recibir esas atenciones, y en la misma registraduría están prestas para registrar sus hijos, pero hay muchas barreras y brechas que impiden que esto sea una realidad. En Colombia, en el departamento del Chocó, se logró, se está logrando gracias al proyecto Partera Vital, y no, pues es triste decir que gracias a la pandemia, pero si la pandemia no llega, no reconocen que hay otros medios por los cuales las mujeres nos podemos comunicar y podemos contar estos hallazgos. Los invito a todos a participar. UNFPA tiene todo el conocimiento y las fases del proyecto. Nosotros queremos seguir en esta labor y que esta labor siga a otros países, a otros departamentos donde se pueda replicar esta experiencia. Muchas, muchas, muchas gracias a ustedes.
Okay, thank you so much, Manuela. This is super interesting. And thank you also for your energy morning, afternoon, and this is a very, very exciting development. We see a lot of people in the Q&A asking for the different studies, from Shannon's to the last couple. So do note that these are being responded to, and we'll make those accessible as to the extent possible. Okay, I'm now going to turn to our last speaker on the panel. Ms. Please, your name has disappeared here. Ms. Tuane Nkasi. We're delighted to have you here from the GFF. And I think there's a lot of questions indeed about how the GFF can support and is supporting this kind of work going forward. So please, the panel podium is yours. And I see we do have slides as well. Over to you, dear.
Thank you very much, Rachel, and thanks to the UNFPA and the IDRC for having organized this session. And I'm going to talk a lot about women, and it's nice to see an all women panel for this discussion. The focus is on gender inclusive civil registration and vital statistics systems and their role in advancing reproductive, maternal, newborn, child, and adolescent health, RMNCH. Primarily, well-functioning CRVS systems provide data that are useful for planning, monitoring, and evaluation of RMNCH programs, and ultimately improve the health and well-being of women, children, and adolescents. For that reason, it is a core pillar of the Global Financing Facility, the GFF, which is a country-led global partnership hosted in the World Bank, committed to ensuring all women, children, and adolescents can survive and thrive. Maybe as I go on with the discussion, people can start making sense of the picture on the presentation. The GFF supports 36 low and lower middle income countries with catalytic financing and technical assistance to develop and implement prioritized national health plans to scale up access to affordable quality care for women, children, and adolescents. The recently established GFF roadmap for advancing gender equality includes increasing country investments in gender responsive monitoring and data systems such as CRVS, while at the same time, CRVS systems have been identified as a priority data system required for sustaining a relentless focus on implementation and results in ensuring that the lives of all women, children, and adolescents are counted and accounted for. In the past 5 years, 21 of the 36 partner countries have included CRVS strengthening in prioritized national health plans. Nearly $100 million US from the GFF Trust Fund and the International Development Association at the World Bank has been provided to 13 countries to strengthen CRVS systems, in addition to domestic resources allocated for CRVS. This has been made possible with the contribution the Government of Canada made to the GFF and the matching of GFF Trust Fund resources to financing from IDA. As a result, countries have been able to develop and strengthen their CRVS systems, building as much as possible on existing systems and processes to ensure a focus on sustainability of the systems. Equitable, gender responsive, sustainable, and resilient CRVS systems are necessary in support of efforts aimed at improving the lives of women, children, and adolescents, which is a key priority of the GFF. By their nature, CRVS systems are continuous, they are permanent, compulsory, and universal. These characteristics need to be maintained to ensure that CRVS systems are able to deliver on their three main functions for legal, administrative, and statistical purposes. In the last 4 years, several GFF partner countries have made good progress towards building well-functioning CRVS systems, and some are incorporating gender-responsive approaches, as observed in this picture. It was taken in one of the hospitals in Rwanda, where provision of civil registration services and health facilities was launched in August 2020 through the support of the GFF and the World Bank Group. The government amended a national law to start allowing officials at health facilities to register births and deaths and issue certificates, paving way for timely and electronic registration and certification of vital events. GFF funding supported the development and upgrading of electronic registration systems, behavior change communication campaigns, and training of government officials at various levels to more effectively register and monitor births. A total of 483 health facilities in all 30 districts in Rwanda are now connected to the national system, and more than 4,500 officials across the country have been trained in civil registration and how the upgraded system links to the National Nutrition Program, making it easier for families to apply for support. This picture, which is now I think where I just need us to focus on, shows a practical approach to the convergence of CRVS systems, gender, and RMNCA age. From an RMNCA age perspective, the twins were born in a health facility and survived, and the mother delivered in a health facility during COVID-19 and survived childbirth. For CRVS, birth registration is taking place in a health facility where the births occurred. Registration and issuance of birth certificates are completed soon after the birth. Registration information is captured into an electronic system, and we see both the mother and the father at the time of registration. Process was also gender inclusive, as women in particular no longer have to take leave from work or childcare duties to travel to one of the local government offices to have their children registered. They now have a system to register their birth in the health facility right after birth. We have seen how essential health services were severely affected by the COVID-19 pandemic, especially in the poorest countries with the most fragile health systems. Across GFF's 36 partner countries, there has been up to a 25% drop in coverage of life-saving health interventions for women, children, and adolescents since the pandemic struck. This is equivalent to 82 million children not receiving oral rehydration when unwell, 17 million children missing vaccinations, and 4 million pregnant women being unable to receive care during childbirth. In many GFF partner countries, limited civil registration services have been provided during the pandemic, which will require a significant catch-up. The importance of a well-functioning CRVS system to monitor deaths was particularly highlighted during the pandemic to generate timely and continuous data for public health response. The GFF aims to contribute to the achievement of the 2030 SDGs for RMNCH in 50 countries. 4 of the 8 core impact indicators, that is maternal mortality ratio, under 5 mortality rate, newborn mortality rate, and adolescent birth rate, can be measured on a continuous basis at national and subnational levels from well-functioning CRVS systems. However, according to the 2021 World Development Report, Data for Better Lives, CRVS systems are not complete in any low-income country, compared with completeness in 22% of lower middle-income countries, 51% of upper middle income countries, and 95% in high income countries. In the short term, while further progress is being made to improve CRVS systems, especially on the registration of deaths and recording of causes of death for males and females, data gaps for routine data exists. As such, reliance continues to be made on periodic household surveys to determine progress on indicators such as maternal mortality ratio. Continued financing from governments and donors will be needed to address the needs. The World Bank, with its links to governments, including ministries of finance, and the Global Financing Facility with technical support on CRVS and enhanced focus on partner alignment, are providing a powerful combination to not just implement CRVS activities, but to develop CRVS systems that are sustainable in the medium to long term, with evidence indicating that it can take 3 to 4 years to establish well-functioning CRVS systems with proper alignment. The health sector itself, if utilized appropriately, can play a huge role in strengthening CRVS systems, given the number of births and deaths occurring in health facilities. In many countries, coverage of deliveries in health facilities and vaccinations are well above birth registration rates. This creates opportunities for countries to support policy reforms to facilitate the registrations of newborns and children who come into contact with the health sector, as well as all deaths occurring in health facilities or captured by community health structures. Birth and marriage registrations can also contribute towards the protection of young girls from early marriage. Early marriage, as it has been discussed earlier, often leads to early pregnancy and childbearing, heightening risks of adverse health outcomes for adolescent mothers and their children, and limiting their future socio-economic prospects. In line with the vision of the Human Capital Project supported by the World Bank, we would like to see children live in a world in which they reach their full potential, growing up well-nourished and ready to learn, attaining real learning in the classroom, and entering the job market as healthy, skilled, and productive adults. Gender-responsive CRV systems are therefore a pathway to improving the health and well-being of women, children, and adolescents. The data generated from well-functioning CRV systems provide mortality and fertility indicators available on a continuous basis and at subnational level, which are of specific importance for planning, monitoring, and evaluation of RMNC age programs. CRVS systems have proved to be particularly important during pandemics to help governments with data required for timely public health response and recovery efforts. Concerted efforts, therefore, need to be made to align resources for strengthening sustainable, resilient, and gender-responsive CRVS systems, incentivize governments to support the needed reforms, and advocate for increased domestic resources to support CRVS systems for improved health and well-being of the general population, but more so for women, children, and adolescents. Thank you.
Thank you so much, Malatela, and for the call to action again for resources and integration and partnership. I want to thank all of our panelists for the incredible interjections here, and I just want to draw your attention to the Q&A because there are some specific questions to some of you. Thank you again. And I'm now gives me the pleasure to welcome Tariq Khan for our next intervention. And Tariq is the Director General for West and Central Africa at Global Affairs Canada. Tariq, over to you.
Thank you so much, Rachel. Can you hear me okay?
Yes, perfectly.
Great, thank you. Good afternoon. Bonjour tout le monde. Deputy Executive Director Keita, President Jean Lebel of IDRC, distinguished panelists, partners, and friends. I'm very honored on behalf of Canada and our Minister for International Development, the Honorable Karina Gould, to provide some closing remarks to help to bring some closure to such a rich discussion on the fundamental role of civil registration and vital statistics and the role they play in improving women's rights and empowerment. So for the last decade, Canada has been a champion and a strong defender of civil registry and statistics. We've worked with many amongst you in order to help enable more inclusive and sustainable development that doesn't leave anyone behind. In 2017, Canada implemented our first feminist international assistance policy, which aims to reduce the disproportionate effects and the systemic barriers and structural barriers faced by women and girls throughout the world. And this policy puts a particular priority on investments that have for their objective to improve gender disaggregated data, and also systems of civil registry and vital statistics that help states and governments achieve policies and programs that are aimed towards and help achieve gender equality. So I'd just like to say a word as well, just to thank our colleague, Lady Manuela Mosquera Moreno, por haber compartido con nosotros el papel de la sociedad civil y de las parteras cuando están trabajando conjuntamente con las agencias del gobierno para crear un sistema que incluye a otros actores también con el gobierno. We heard some really great and rich example in that particular case of how sometimes maintaining a civil registry system and a vital statistics system actually goes beyond the immediate role of government, and that there are other partners that have to be brought into the system itself for it to reach some of the most poorest and the most vulnerable. So as the presentations we heard today highlighted, the CRVS systems are fundamental cornerstones for human development, for rights, for security, for health governance. These allow governments to reach the most marginalized populations, provide legal identity, facilitate access to essential services. This is how we make sure women and children are not left stateless, how we make sure they can access essential services like healthcare, education, and financial services down the road, and how they're able to exercise their social and political rights. These aren't just tools that enable each person to be counted, but they're also the means of reducing gaps in inequality and enabling donors, communities, government institutions to better identify gender obstacles, evaluate gaps between the sexes, develop policies and programs that are facts-based, that are evidence-based, and also measure progress towards gender equality. And we know that creating effective CRBS is more than just a technical issue. We need to help ensure that systems are gender responsive and based on real analysis of data that is aimed at reducing barriers and improving health equity, as an example, that they're ensuring that marginalized regions in any particular country and the district of Chocó, which Lady Manuela spoke from, is a great example of one, that those communities and those people are consulted, that they're targeted, they're integrated from a systems point of view. And they also help us overcome additional and specific barriers faced by women and girls in accessing registration services, and they ultimately help us improve registration rates and data gaps. So governments at all levels clearly need to be in the driver's seat when it comes to developing and strengthening CRBS systems, integrating them into national plans, and allocating domestic resources. It does require investment and budgeting. But they also need to be working in partnership with organs outside of the government to reach the poorest and most vulnerable. I'd like to just add also that the full data of civil registries is only realized when that data is integrated into other government systems, such as statistical institutions, population registers, national ID systems, and voter registration systems. So that integration is really important from a data point of view, and that we really need to continue advocating and raising awareness on the value that gender responsive CRBS have for sustainable development. Fostering demand within local communities to actually register and increase birth registration rates means conveying at a community and a subnational level the fact that everyone matters, that the agenda is about inclusion, and that you benefit from actually registering. And then I'll just say a few words just about partners. Since 2010, we've been really happy to collaborate with partners like IDRC, UNFPA, the GFF, UNICEF, in order to strengthen civil registry and statistical systems that are focused on improving access and to quality data. As an example, our investments since 2015 in the GFF have been significant, and I think they've enabled a number of countries to strengthen their overall CRBS systems. And then finally, just to say a word about multilateral platforms like the Generation Equality Forum, this is going to offer us an opportunity to highlight, advocate, and coordinate our efforts to strengthen gender responsive CRBS systems that benefit women and girls around the world. So the presentations and arguments and comments we've heard today, they paint a striking picture of what happens when CRBS systems are strong and when they're reinforced, and what happens when those systems are weak. So supporting programs like Converge and community networks is only going to help us build greater momentum towards more equitable and inclusive data systems that leaves no one behind. And so I just want to conclude by saying that let's keep marching forward on developing evidence-based, gender-sensitive policies and programs that are going to further inform and influence upcoming discussions like the Gender Equality Forum, and making concrete progress on gender CRBS and the SDGs. And please rest assured that Canada stands with you in this effort. Thank you.
Thank you so much, Tariq, for these words. This is enormously helpful. And as you say, it's so much more than a technical matter. I think the quotes we saw from Priska were particularly strong in reminding us of how much this is about entrenched gender norms. So thank you. We're so grateful for the support of Canada and the partnerships that we've been able to forge with you. Allow me now on this next to last comment here, we have Nafi. Please Diop with us, and I'd like to welcome Nafi. Nafi is the branch chief for gender and human rights at UNFPA, and we would really ask her please now to give us some reflections on the implications for the overall gender and human rights work that you are leading within UNFPA. Welcome you, please. Nafi, the floor is yours.
Thank you so much, and thank you for allowing me to share a few reflections about what we heard today. I would like to thank, of course, our esteemed speakers for their rich presentations, and particularly my chief, Ms. Keita, who has been so supportive for the work on gender equality. as well as I would like also to thank all the participants. I saw that about 250 people are connected and listening to those presentations and asking a lot of questions actually in the chat. So there is, of course, the need for more information. So I hope that the speakers will be able to share their presentation. And people are really want to have more information in that particular issue. So this is something that we need to keep in mind and try to do more dissemination activities on that particular issue, and also try to bring more government people and speakers on board. This event has highlighted the strategic value of civil registration and vital statistic systems in advancing gender equality and women's empowerment. We heard how civil registration is critical for protecting the fundamental rights and freedoms and bodily autonomy of many women, girls, and marginalized groups. Legal identity, proof of age, and civil status facilitate access to key rights and services, including those related to social protection, voting rights, employment, health, education, resources, land and credits, and the list is long. We heard about how vital statistics generated from civil registration can provide valuable data needed to monitor progress toward gender equality, including the SDG targets related to sexual and reproductive health and rights, maternal and infant mortality, education, gender-based violence, harmful practices such as child marriage. Through practical and concrete country examples, our speakers spoke about the importance of all women and girls being counted, and most importantly, made visible throughout all the stages of their lives. But it also underscores how around the world, too many women and girls still face many cultural, financial, and legal barriers to experiencing the full benefits and protection of civil registration. Invisibility in data is driven by the same norms that lead to other forms of discrimination and violence against women and girls. It is simply unacceptable that 1 in 3 women still face gender-based violence, that only 55% of women around the world make their own sexual and reproductive health decisions, and that 1 in 5 girls is married or in a union before she reached the age of 18. I would like to make a call to action for all the human rights defenders, for the feminist movement to embrace, harness, and use this data to help fight unequal power relations, stereotypes, and values, which are ultimately driven by patriarchy. Including CRVS data can be transformative, but we have to fight hard to ensure the sex differentials in CRVS are eliminated. There is a reason why data is a foundational and cross-cutting pillar of the Generation Equality Forum and its 6 action coalitions. As UNFPA, co-lead of the Action Coalition on Bodily Autonomy and SRHR, along with the International Women's Health Coalition represented here, GFF, and many others, we will ensure that population data is harnessed and utilized to its full potential to provide the demographic intelligence and evidence we need to push our agenda on gender justice forward. Thank you so much for your attention and attendance, et merci beaucoup à tous les participants. Merci encore au Canada.
And thank you so much, Nafi, for those comments about injustice and why we support something which sounds dry at times, a population data system. But as you say, it's all about being able to contest inequalities. Thank you so much. And I would like now, if I may, to turn to our distinguished Deputy Executive Director, Dieni Keita, to close the meeting with your final remarks, please. Dieni.
Thank you. Thank you so much. Thank you so much, Rachel. You know, it's Ramadan and afternoon become difficult without water. What a fantastic moderation and well spent time. Nafi, you rock, and thank you for your extraordinary call of action. Rest assured we are with you on this. What a session. I was inspired by my new best friend, Jean Lebel remarks. On behalf of UNFPA, my sincere thanks and appreciation to President Jean Lebel. Merci infiniment. Thanks to you, Director General Tariq Khan. And you are so right. It takes more than government to get CRVS system work well. And thank our distinguished panel of presenters, Shannon, Prisca, Lady Moreno, Maletele. Thank you so much to all of you. Director General Khan, your tireless efforts and leadership are crucial in empowering us towards transformative results for women and girls everywhere. Our deep appreciation for the Government of Canada for the long and deep partnership with UNFPA in advancing the ICPD Program of Action and the 2030 Sustainable Development Agenda. As we mobilize around the Action Coalition of the Generation Equality Forums and accelerate our effort through this decade of action, we work together towards immediate and irreversible progress towards gender equality. Today's discussion highlights the transformative potential of inclusive CRVS system, particularly for women and girls, and for the Leave No One Behind agenda. So let's continue to build up our partnership to eliminate barriers women and girls are facing in ensuring their birth, marriage, divorce, and death to be registered, as this impedes their basic rights, bodily autonomy, and contribution to society. However, we have also heard inspiring stories of partnership between midwife in Choco, Colombia, and the National Statistics Agency that ensure that inclusion of Afro-Colombian women and girls in the civil registry and their visibility in official vital statistics. Muchísimas gracias, Lady Moreno. Now it is the time, more than ever, to expand this effort. UNFPA welcomes your engagement and partnership in this effort. Once again, warm thanks to all of you for an engaged session. Je vous remercie et à très bientôt. Au revoir.